welcome to Medical Dialogues. I'm Mr. Zaman and here's what I bring to you all from the world of medicine. A novel generic treatment for various forms of cancer. Researchers led by Katsunori Tanaka at the Riken Cluster for Pioneering Research in Japan and Hiromitsu Haba at the Riken Nishina Center for Accelerator-Based Science have developed a new technique that has the potential to generically treat several kinds of cancer with fewer negative side effects than currently available methods. The new technique relies on basic chemistry and the fact that a compound called acrolein accumulates in cancer cells. In the new study, rather than simply detecting cancer cells, the team targeted those cells for destruction. The logic was fairly simple. Instead of attaching the azide to a fluorescent compound, they attached it to something that can kill a cell without harming surrounding cells. They chose to work with astatine-211, a radionuclide that emits a small amount of radiation in the form of an alpha particle as it decays. Compared to other forms of radiation therapy, alpha particles are a little more deadly, but they can only travel about 1/20th of a millimeter and can be stopped by a piece of paper. In theory, when astatine-211 is anchored to the inside of a cancer cell, the emitted alpha particles should damage the cancer cell but not much beyond. Bariatric surgery reduces cardiac risks and mortality in obese patients with sleep apnea. Bariatric surgery, also known as weight loss surgery, was associated with a 40% reduced risk of adverse cardiovascular events, including heart attack, stroke, and atrial fibrillation in patients with moderate to severe obstructive sleep apnea, according to a new study from Cleveland Clinic and presented recently at the American Society for Metabolic and Bariatric Surgery annual scientific meeting. Researchers also report metabolic surgery patients cut their risk of death by nearly 40%. OSA is a dangerous sleep disorder that affects nearly 1 billion adults worldwide. About 70% also have obesity. Obesity can cause excess fat to deposit around the upper airway, which can compress the upper airways and interfere with breathing during sleep. Standard treatment is with continuous positive airway pressure or CPAP, but the therapy only addresses symptoms. It's not curative and does not reduce the risk of MACE or death, which has a high incidence among patients with OSA. High doses of oral semaglutide improve blood sugar control and promote weight loss. Diabetes is a progressive disease that affects one's ability to control blood sugar levels. For many patients, the condition becomes more severe over time and blood sugar levels grow more difficult to manage. Glucagon-like peptide-1 or GLP-1 receptor agonists, such as semaglutide, have granted patients more control in lowering of blood sugar. The study found that once daily oral semaglutide taken at 25 mg and 50 mg did a better job in lowering blood sugar levels and promoting weight loss than the lowest dose of 14 mg. The new study is in line with other studies which are pushing for the use of oral GLP-1 receptor agonists as a treatment for obesity. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.